Before using Xolair Vial, it's important to read the medication guide provided by your pharmacist and follow the instructions for use leaflet if you are using this medication at home. This medication is injected under the skin as directed by your doctor, usually every 2 or 4 weeks for the treatment of asthma or nasal polyps, and every 4 weeks for the treatment of CIU. The first dose will be given by a healthcare professional and you will be monitored for any severe allergic reactions. Later doses may be given by a healthcare professional or at home. If using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. To make it easier to inject, take the pre-filled syringe out of the refrigerator and let it warm to room temperature for at least 15 to 30 minutes before injecting. Do not warm up this medication in any other way, such as heating in the microwave or placing in hot water. The dosage for the treatment of asthma/nasal polyps is based on your weight and lab test results before you start treatment. Your dose may need to be adjusted if you have any big changes in weight during treatment. The dosage for the treatment of CIU is based on your medical condition and response to treatment. Use this medication regularly to get the most benefit from it and mark your calendar to keep track of when to get the next dose. If your asthma symptoms worsen or if you are using your quick relief inhaler more than usual, seek medical help right away. It's important to be aware of the potential side effects of Xolair Vial. You may experience itching, bruising, redness, pain, or swelling at the injection site, as well as headaches. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. However, it's worth noting that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience any serious side effects. That being said, it's crucial to contact your doctor immediately if you experience any serious side effects, such as unusual lumps, moles, or skin changes, numbness or tingling in your arms or legs, worsening shortness of breath, coughing up blood, muscle or joint pain, or signs of infection like a persistent sore throat, fever, or cough. In the event of very serious side effects, such as chest, jaw, or left arm pain, unusual sweating, weakness on one side of the body, sudden changes in vision, confusion, trouble speaking, or pain, redness, or swelling in the legs, seek medical help right away. It's important to note that this is not an exhaustive list of potential side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can also report any side effects to the FDA, and if you are in Canada, you can report them to Health Canada. Before starting Xolair Vial, make sure to inform your doctor or pharmacist if you have any allergies, including allergies to omalizumab. This medication may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, be sure to inform your healthcare provider about your medical history before using Xolair Vial. If you are planning to have surgery, make sure to disclose all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Xolair Vial should only be used if clearly needed, so be sure to discuss the risks and benefits with your doctor. It is also unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding while using Xolair Vial. It's important to be aware that Xolair Vial may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's essential to follow your doctor's guidance and not make any changes to your medication dosage without their approval. If someone has taken too much Xolair Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Before starting Xolair Vial, it's important to undergo lab and/or medical tests, including lung function and antibody levels. These tests should also be conducted while you are using the medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. It's important to avoid substances that can worsen breathing problems, such as smoke, pollen, pet dander, dust, and mold, as these can cause irritation or allergic reactions. Xolair Vial is typically administered by a healthcare professional and the dosage is based on your medical condition and response to treatment. It is usually given every 2 to 4 weeks. The best time to take Xolair Vial is determined by your healthcare provider based on your individual needs. Be sure to follow their instructions carefully. Make sure to take each dose of Xolair Vial as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist immediately to determine the best course of action for your new dosing schedule. When storing Xolair Vial, make sure to keep it in the refrigerator, but do not freeze it. Keep it in the original carton and protect it from direct sunlight. Once you take it out of the refrigerator, you must use it or discard it within 4 hours. It's important to keep all medications away from children and pets. Additionally, it's important to properly discard Xolair Vial when it is expired or no longer needed. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It may be helpful to consult your pharmacist or local waste disposal company for guidance on the proper disposal of this product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.